that time of year when Californians can sign up for health insurance or make changes to their existing health plans.
Right now, open enrollment is underway for Covered California. Jessica Altman joins us now. So thanks for joining us, Jessica. What are the big things that people need to know about for this year?
The most important thing that people need to know is it is open enrollment, and now is the time to think about your health insurance coverage for 2024. We know that we have over 1.3 million Californians who are eligible for either low or no cost coverage through Covered California for Medi-Cal, yet continue to go without health insurance. So now is the time. Help is available, as well as financial assistance. In fact, 90% of those covered through Covered California receive financial assistance, and 2/3 of those can find a quality name brand health insurance plan for a cost of $10 or less per month.
Oh, Jessica, how long does open enrollment last, and what are people looking for in terms of prices?
Yeah, open enrollment lasts until the end of January, but it's very important to know that if you want coverage for all of 2024, if you want to be covered on January 1st, you do need to apply by the end of December, so December 31st. But we're open now, so why wait? Now is the time. Get it done before you have to get that holiday checklist out of the way. In terms of cost, of course, people are very focused on the monthly premium cost. Again, I said people are finding coverage for less than $10 a month $10 per month. Very important to know we don't have income limits. Anyone can come to Covered California. It's just that the financial assistance we offer is varied based on your income. So the more that you need, the more that you get. We're also launching a new program this year with the support of the legislature here in California and Governor Newsom, making sure that not just is coverage affordable, but also care by lowering out-of-pocket costs. And that program, among other things, will completely eliminate deductibles for over 650,000 of our current enrollees, for many who may enroll newly this year, and that would be for anyone under 250% of the federal poverty level. That's about $35,000 a year for an individual, or $70,000 for a family of 4.
Jessica, you mentioned more than 1 million people, would get some of those subsidies, would get lower coverage costs, but are not going for those premiums. Why is that?
Yeah, I think I talk every year to people who think it's not for them, think it can't possibly be affordable, think they make too much money. So if you're one of those people, I would certainly say at least take the few seconds, literally seconds, it takes to explore your options. You can come to coveredca.com. You can enter just 4 basic things about yourself and your household and get quick information about what financial assistance you're eligible for and what the monthly premium cost would be in your region. I think a lot of people have other complicated reasons, but one thing we want to make sure is it's not because Californians don't know that they have options, because Covered California is here and we are open for business.
Great. Jessica Altman, thank you so much for your time. We appreciate it.
Thank you for having me.